Dr. Julie Downs is the director of the Center for Risk Perception at Carnegie Mellon University and was cited in this article and joins me now from Pittsburgh to go in depth on this. When did the downplaying of this virus begin, do you believe?
Something seems very new, it seems very frightening to them, the risk seems very high. And as we get more used to something in our lives, our perception of the risk tends to come down a little bit. So I think as we've gotten used to the novel coronavirus as something that's in the environment, our sense of its risk has kind of diminished over time. And there have been other forces, of course, at play, but that's something that's just happened naturally psychologically.
Okay, well, this article cites research that suggests that a failure to embrace COVID-19 restrictions could be fueled by a lack of empathy. Can you explain that? Basically, it boils down to if it hasn't affected my life, it doesn't matter as much?
Yeah, if it's not very close to you, if you don't have experience with it, if it's hard to sort of call to mind a case of somebody experiencing a bad outcome from COVID, then we tend not to think of things as being as likely to happen if we have a hard time imagining it happen. So you can imagine people in places where the virus hasn't really come through yet, it doesn't seem very real to them. And so when they think about the risk they're facing, they don't think of that risk as being all that high. Contrast that to people in a place where there are people they know who have been in the hospital, maybe even people they know who have died, people they know who have tested positive. It's very easy for them to call to mind instances of people getting this virus and having negative outcomes. And there's a lot of research showing that the more easily we can call something to mind, the more likely we think that thing is. So the more experience we have, the more likely we are to think, yes, this is something that could really happen. It could really happen to me.
You know, we live in a community here in Rochester, Minnesota, with one of the world's leading medical facilities. We should be doing more to keep our medical professionals as safe as possible, and yet we see that and I know you're not the political expert on this, but it really is drawn by political lines on this. How do we change that?
That's a good question. We've been actually trying really hard to change those things in an ongoing research project that some of my colleagues and I have been working on for the last few months. And it's very difficult to get those behaviors to change. You know, people are very invested in their perceptions. And when you're so invested, it's really hard to distance yourself and to take another view. But we do know that making a risk seem more central and more available to people's memory and to people's sort of awareness can increase that. We've seen lots of cases of people who will admit that they had sort of distanced themselves. They had sort of said, oh, I wasn't concerned. You know, I thumbed my nose at the experts and I wasn't so concerned about the virus. And then I got it, or my child got it, or my parent got it, or, you know, somebody they know got very sick or even died. So we've seen many, many cases, I mean, you know, for politics, including Chris Christie just recently, coming forward and saying, I was wrong to think that this was safe, everyone should wear a mask. And so we do see people one by one kind of making these turnarounds, and usually often it does come from direct experience.
The difference if it's somebody personally that we know and love, or if it's somebody famous who we know and admire and personally follow, like the president. When he contracted COVID-19, a lot of the political talk became, well, maybe people will start taking masks more seriously now.
Yeah, and either one can have an effect. It really has to do with our perceptions of where, you know, is this thing out there? How much of a threat is it? How many people are getting it? Is it something that I can call to mind lots of instances of people having it? That all leads to a greater perception of risk. But a lot of times it's what people do with that information. You know, do people say, this was something that happened to me, it was bad, and everyone should wear a mask, in which case that, you know, I think that there's the sort of perceived risk of the novel coronavirus, but there's also this faith in how we can prevent the infection from taking place. And there's been some misinformation around masks. Early on, there was a sense that there wouldn't be enough masks for our essential medical personnel. And so the message was that other people shouldn't wear masks because we should preserve them for the medical personnel. And I think that message got a little confused when it changed from that to saying, well, actually, masks can protect everybody. We can learn how to wear them properly. etc. And so the message started out being confused from the very beginning about whether masks are really recommended. Now, of course, masks are recommended by, every serious expert. The analyses show that if everybody wore masks, whenever they were out, it would really cut the rates of infection and deaths dramatically. But there's a lot of mixed messaging around that.
Since you're a professor of psychology and decision science, what has probably surprised you the most since this virus has come into this country?
I've been surprised at how quickly we switched from being very concerned about this new risk. There's a lot of research showing that when a risk is new, people are very concerned about it. They are less tolerant of it. They are much more nervous about it. To fatigue, to pandemic fatigue. People now are saying anyway that they're tired of being cooped up in their houses, and maybe they're going to go out and have a meal or something that they've missed doing. They're not as concerned about the risk as they were just 6 months ago. I'm surprised how quickly that happened.
Well, as we know, when something big happens and it's new, we all jump on almost the fear boat, and that's kind of where we were. And then we were in this together, and now we are so incredibly divided. That's why I wanted to have this conversation with you. And so it is important that we continue to have these kinds of conversations and get people thinking. That's at least my hope.
Mm-hmm. Agreed.
Yes. Dr. Julie Downs, thank you so very much for your time and your insight on this.
Thank you, Betsy, for having me.
Yes.